Relocating to Ireland, nursing versus healthcare assistant.
Worker in Ireland, there are two pathways that you can actually take through, and each of these pathways comes with its terms and conditions, let me put it that way. So if you're looking forward to find a general nursing, psychiatric nursing roles or midwifery roles, you cannot just start applying for those jobs. You have to go through a process, which I have already done a video about that on my YouTube channel, so you can slide into that at Nurse Sabina and go through my playlist and watch those videos. It's a process that you have to go through. Certain documents are required from you. You have to go through a lot is required if you want to work as a nurse or a midwife in Ireland. And one other thing that is required of you is to take the English test, which is the IELTS or OET. So that is if you want to work as a midwife or a psychiatric nurse or a general nurse in Ireland. That is the process that you have to go through. You can't just start applying for those jobs because you have a midwifery license, because you have a general nursing license, because you have a psychiatric nursing license. You can just go ahead and you see any of those roles online and then you start applying for that. No, it doesn't work like that for these three groups of registered nurses. But let's look at healthcare assistants. That is our fellow nurses who were trained for, let's say, 2 years or less. But you may be recognized as a nurse in your country, but in Ireland here, if you had a nursing training for less than 3 years, so that is 2 years and below, you are not recognized as a nurse in Ireland. So the other employment route that you can take is the healthcare assistant route. So you can apply for jobs like healthcare assistants, assistant support worker, or carer. So those are the category of healthcare jobs that you can apply for if you have less than 3 years certificate as a healthcare giver. Okay, but this particular one, you don't have to go through any process to apply for the job. The most important thing is you have a healthcare certificate. It's just a matter of you finding vacancies online, job vacancies that are looking for healthcare assistants or support workers, and the company is providing visa sponsorship. That is where you can just go ahead, make your CV, and then attach your healthcare certificates to it, and then you apply for it. You don't have to go through any board registration. No, you don't go through that. So I can be a nurse and then I will decide to migrate as a healthcare assistant or a support worker, so I don't have to go through the nursing board registration. No, I will just start applying for those jobs online. If I see any of those support worker roles or health assistant roles and the company is providing visa sponsorship, then I qualify to apply because I have experience as a healthcare worker. Okay, so those are the two distinct difference in coming as a nurse and then coming as a healthcare assistant. Know the difference. But one thing that you have to know is, coming as a healthcare assistant, it is not easy finding the visa sponsorship jobs because the application is it's very tight. Sometimes they have a quota, they have number of candidates that they are taking outside Ireland. So sometimes they don't really take a lot of people. And this is where some agencies comes in. You can get an agent who may help you get a job, and then you pay for all those things. You pay for your permits, pay for the visa and all that. I don't know much about it because I am not a recruiting agent. I don't recruit. So, but all I know is if you get an agent, the agent can get the job for you, and then you pay for all these stages, pay for the visa and then the work permit and all that. But if you get the visa sponsorship contracts, the company provides the work permit and the visa for you, so you don't end up paying those huge amounts of money that the agents tend to charge people for. But if you are a nurse or a midwife and you are coming through the nursing route, you don't have to deal with any agent, because you are going through the board registration. You get all the required documents for companies to sponsor you and then bring you in. You come and take your OSCE or you do your adaptation and then you get your license. So you have nothing to do with an agent. Unlike someone who is coming as a healthcare assistant, if you are not fortunate to get selected by the company directly from your application, they select you, you pass the interview, you get a contract, and then they will apply for the work permit for you. If you don't get this, then you may have to go through an agent who may, see to all of these for you and end up charging you a huge amount of money. If you don't have that money, then all you need to do is to sit up and then go online, be searching for healthcare assistant jobs with visa sponsorship, and then if you come across one, make sure you amend your CV and then you apply for. Who knows, it could be your shine one day, because I know few people who were able to land a job offer as support workers through them visa sponsorship applications. It doesn't come easily, so it's very tight. So you need to make sure that your CV really suits what they are looking for. That's why I always say amend your CV before you apply for any vacancy. Check what they are looking for and then edit your CV to suit it before you apply. Who knows, this year could be your chance. So those are the differences. So if you are dealing with anyone for healthcare assistance and the person is requiring for your nursing license, the person is asking you to write IELTS, especially if you're coming to Ireland, you don't need those things. You don't need your nursing license for anything if you're applying for healthcare assistance. What matters is you providing your certificate that you have a healthcare background. The license from the Nursing and Midwifery Council doesn't matter in your case, okay? Unlike those coming as nurses and midwives, okay? You don't need IELTS or OET if you're looking for healthcare assistant job or support worker jobs. Unlike nurses and midwives, who needs it? It's a mandatory test that nurses and midwives needs to take it in order to go through the process and come in and practice as registered nurses and midwives. I hope this clarification is good for you to know what exactly you are going in for. So if you are dealing with someone for support worker roles and the person is asking you for your nursing license, bring IELTS, there is no need for that. The most important thing is if you're looking for support worker roles or healthcare assistant, just have a certificate to prove that you have a healthcare training, okay, and then you have some work experience, and then you start applying. You don't have to go through any process, okay? So those are basically the major difference between someone coming to Ireland as a registered nurse or midwife and then someone coming to Ireland as a healthcare assistant or a support worker. I hope this is clear. I'll see you another time. All the best. Bye.